Family Planning Association of India gundu ja 75 sal sexual reproductive health bor de kam grina ayase taiken emergency time khande sexual reproductive health services can be include koribi koagina campaign koribole irada thaka janai dishe itu nimite taiken alag alag departments kan nugude collaborate koribole lagi thaka goshe Family Planning Association of India bra taiken laka kam nimite sprint 4 project bi launch koria goshe kundu dukh pai thagya jaga khande manu effect hua khange Muria nahulibi disable hua rukhabole karne Jivan Pachalaga activities kunuba Korea kushe. Ito bor aji press conference lade ekta sabo.
In Nagaland, we have not had so much of a problem or humanitarian crisis that we had to keep things in order. So it is only in times of landslides or mock drills on earthquakes. So those are the activities that we have been basically doing when it comes to disaster or humanitarian issues. We are all aware our neighbor Manipur state has gone through problems. And we, as Family Planning Association of India, we conducted 29 health camps in Manipur state as a humanitarian response to the violence affected people. We have visited 29 relief centers and we were able to reach out to 3,000 plus people with sexual reproductive health issues. And keeping this experience in mind, Northeast has a protracted humanitarian crisis going to be prepared for any emergencies. And this is where our mandate goes, sexual reproductive health in emergencies. I will read out the things that I've written that will be faster. Family Planning Association of India, which has been working on sexual reproductive health for the last 75 years, has launched the Sprint 4 project, which focuses on preventing sexual and reproductive health to prevent morbidity, mortality, and disability in crisis-affected population. Over 110 million people have been forced to flee their homes, driven by three interconnected realities: violent conflict, climate change, and extreme poverty. Almost half of these are children. We are living through the greatest displacement crisis recorded in history. During conflict, natural disasters, and public health emergencies, sexual and reproductive health needs are often overlooked, with staggering consequences. Pregnant women risk life-threatening complications without access to delivery and emergency obstetric care services. Women and girls may lose access to family planning services, exposing them to unintended pregnancy in perilous conditions. Women and girls also become more vulnerable to sexual violence, exploitation, and HIV infection. During times of emergencies and crises, people are evacuated to relief centers or neighboring communities or villages. The effect of emergencies differs from community to community. In such situation, protection mechanisms and service delivery breaks down. Sexual reproductive health services are essential and will have to be continued. Fpai India, with its minimum initial service package, we call it MISP, ensures that clusters are identified through organizations to lead MISP implementation. this preparedness for MISP through training of humanitarian, this preparedness of MISP through training of humanitarian personnel in collaboration with volunteers, partner organizations, district level disaster management and health service delivery systems. Pre-preparedness is to bring all stakeholders together for collaboration and ready to respond to emergencies. FPA India Nagaland branch is among 12 branches across FPAI network selected for implementation and training and advocacy that will respond within 72 hours where normal functioning and machinery needs supportive action. The MISP, that is a long term, which we call it minimum initial service package. This is a very important service package for FPA India. The minimum initial service package is set of life-saving activities to be implemented at the onset of every humanitarian crisis. It is an internationally accepted minimum standard of care for reproductive health, pioneered and rolled out by International Planned Parenthood Federation. The sexual and reproductive health services set out in the MISP can mean the difference between life and death for people affected by disaster. What is minimum initial service package? We call it 6+. 6+. 1. Ensure health cluster identifies an organization to lead the MISP for SRH. That is 1. 2. Prevent sexual violence and response to the needs of survivors. 3. Prevent morbidity, mortality due to HIV and STIs. 4. Prevent excess maternal and newborn morbidity and mortality. 5th, prevent unintended pregnancies. 6. Plan for comprehensive SRH services integrated into primary health care and as soon as possible. And 6+, we call it 6+. It's not 7, but 6+. Ensure that safe abortion care is available to the full extent of the law in health center and hospitals. We have 6 MISP plus, and the plus is ensure that safe abortion care is available to the full extent of the law in health centers and in hospitals. So why are we talking about MISP? Why are we talking about sexual reproductive health in emergencies? This is all because time is coming. Before it comes, we should be prepared. We should let the policy makers, we should let the people at the helm of affairs understand the need for services, focused services on sexual reproductive health, even in emergencies. In emergencies, in humanitarian settings, in disaster settings, crisis settings, what we normally look at is safety, food, shelter. Safety, food, shelter. But we overlook very important factors of sexual reproductive health needs of people of affected population. And that is why Family Planning Association of India under Spring Project. Spring Project is being funded by what used to be formerly known as AUSAID, 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 but it is now DFAT, DFAT, renamed. And so our agenda for calling the media people to kindly come and have this media meet is to talk about the works that we do, and also to let you know of our intention to start campaigning, not for the ULB election yet, but to start campaigning for inclusion of sexual reproductive health services in emergencies. So we need to collaborate with Disaster Management Authority, we need to collaborate with civil societies, we need to collaborate with youth, we need to collaborate with health department, we need to collaborate with media so that we are able to jointly put our agenda, advocate for inclusion of sexual reproductive health in emergencies. That is all that I wanted to present.
Our project name is called the C19 RMKP Grant, or the Global Fund Project, which is being implemented from 2023 to 2024. The Global Fund Project, it is a project that aims to provide health services, specifically the sexual and reproductive health services to the key population. It is being implemented in 10 branches, Nagaland being one. The objectives of Global Fund Project are to strengthen pathways to social protection, increase awareness, rights and opportunities, advocacy for change, and to provide integrated health clinic and specialist clinical services, and also to provide CAC sessions to young PLHIVs and services for aging PLHIVs. The key population under Global Fund are PLHIVs, ITUs, MSM, FSW, transgender, non-binary or bisexual, and partners of KPs or high-risk groups. But at the moment, Nagaland branch are focusing on two key populations, that is the PLHIVs and IDUs. Under the Global Fund project, we also have doctor services. We have a medical officer that comes to our clinic every Tuesday and Friday of every month from 1 to 5 p.m. And we also have a specialist services, that is the psychiatry. He visits our clinic every third and fourth Thursday, 2 to 5 in the evening. A physician who visits our clinic second and fourth Saturday monthly, 10 to 12 noon. And we also have an obstetrics and gynecologist appointment. And besides this, we also provide counseling services like ART adherence and psychosocial support, and also lab services like hepatitis, HIV, and STI testing and screening. And we also have monthly programs under GF. Those are 2 CAC sessions with young PLHIV and KP, outreach health services, and support group meetings. And that is a short update or summary on the Global Fund project. Thank you.